If hip pain is limiting your walking and sleep, doctors sometimes suggest replacing the joint. Here's what that means. The hip is a ball and socket joint. The ball sits at the top of the thigh bone, inside a cup in the pelvis. When cartilage wears away, bone rubs on bone. Arthritis, fractures, or loss of blood supply can all damage the joint. Surgery is usually considered when pain limits walking, disturbs sleep, and no longer responds to medication or physiotherapy. In a total hip replacement, the damaged ball and socket are removed and replaced with a metal or ceramic implant. Surgeons use different approaches, front, back, or side of the hip. Each has trade-offs. Surgeons choose what fits the case. The operation takes 1 to 2 hours. Under spinal or general anesthesia, the surgeon removes the damaged bone and fits the new joint. Implants can be cemented into the bone or press-fit so the bone grows into them. Both have strong long-term track records. Most patients stand and take their first steps on the same day or the next with a walking frame and a physiotherapist. Over the following weeks, crutches give way to a stick, then to walking on a. Most people feel recovered by 3 to 6 months. Physiotherapy is essential. Strong muscles around the hip protect the new joint, improve walking, and reduce the risk of falls. Like any major surgery, risks include infection, blood clots, and rarely dislocation. Teams take many steps to reduce these. Modern implants often last well over a decade, and many last 2 decades or more. Younger patients may eventually need a revision. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.